So in this segment, we're going to be talking about the NHS triple whammy this winter, and how bad a situation it is for the NHS because last year was horrible. So I can't imagine how bad it's going to be this year. This year it's not going to be good. Let's put it that way. The NHS is facing a triple whammy of rising COVID-19 cases, a major backlog in treatment, and reduced capacity due to infection control measures, according to health bosses. So one of the reasons why the NHS was able to survive early during the year was because they put off a lot of sort of routine appointments and other kinds of treatment in order to deal with COVID. And so that's one of the reasons why the NHS wasn't completely overwhelmed. But in some ways, because of the lockdown, it did help the NHS as well because there were less people going to A&E. Because obviously there were less accidents, less drunk people that needed help, and etc. But given that the winter times when the NHS really gets hammered, it happens every year, especially since a certain party has taken over, or certain parties took over from 10 to 15. It's not looking too good. So, the government's promised 3 billion, but the fact is you can't underfund something for 10 years and expect it to be brought back with, a lump sum, which probably isn't enough anyways, honestly, because you can't train people in that time. So if we look at this, that money announced over the summer was intended to help hospitals cope with extra infection control measures required. It's not very specific about where that money is going to go to help. But pay for patients to be treated privately for routine treatments such as knee and hip replacements. How much is that going to cost? How much extra is that going to cost compared to how much it would have cost if you did it within the NHS? And so, going to the private sector for help here hasn't actually helped us that much when it comes to things like track and trace. I've no doubt that, these hospitals will do an effective job, these private facilities, but at what cost will it be to get these sort of surgeries done and these sort of hip replacements done? Because the NHS wasn't funded properly in the first place. That's what the point I'm trying to make with this segment is the fact that we wouldn't be in this situation if they didn't cut the healthcare service so much. And Conservatives like to talk about having lean public services, but the NHS isn't a lean public service. The police force isn't a lean public service. They've cut way too deep, and these services don't function as they should do in normal times. In normal times, talking about during the normal summer and the winter, you look at the police force has been cut massively. The NHS has been cut massively. And what that means is during the winter it struggles to cope, and so now when you throw this massive spanner in the works, which is COVID-19. How is the NHS supposed to cope, especially when it hasn't had time to recover really from the last outbreak? If you think about it, it hasn't had time to recover. The staff, all the healthcare workers, everyone hasn't had a proper chance to recover from the last bout. So I worry about them. We covered stories about the mental health of nurses suffering because of this outbreak and the lack of help that they've received. And I don't think that 3 billion will go that far, honestly, because you can't train people that quickly. They won't. The only way you can get extra staff is if you fly them in from another country, which might be difficult, or if you get private care workers in, and that's the only way I can see this happening. But how much will it cost to get these private workers in? NHS Confederation Chief executive Danny Mortimer said a sustainable plan had to be found for the NHS. No one can be in any doubt that the road to recovery for the NHS and social care services will be long, he said, despite dire predictions that it would not cope. The NHS has not only managed a huge wave of COVID patients, but also managed to treat millions not infected with the virus. We have learnt much and are in a better position to manage the virus than first round, despite still not having an effective track and trace system, something we should have had, I think, in April. Dame Dona Kinnear of the Royal College of Nursing called the report deeply concerning. A serious shortage of nursing staff has put a strain on services and the people who worked in them. And the NHS, I think somewhere in this article, has said that they want the government to be honest. Fewer than 1 in 10 said, this is at the 250 NHS bosses, 1 in 10 said the current level of funding allowed them to deliver safe and effective care. Nearly 9 in 10 said a lack of funding would be a significant barrier to achieving waiting times for everyone from mental health care to cancer treatment and routine operations. And what if we have the same problem with sourcing, PPE and things like that? Has the government actually sourced these equipment throughout the year adequately? Or are we going to have another shortage again when, staff had to wear, gear that wasn't protective, that was out of date, etc. And if we look at last year, the fact is last year there were huge problems in 2019. This is pre-COVID, really. This is pre-COVID hitting England. NHS winter extra beds created by 52% of UK hospitals. More than half of hospitals have opened extra beds to help them cope with the NHS winter crisis amid an influx of patients with potentially fatal breathing problems. Many of the so-called escalation beds are already occupied by people suffering from flu, pneumonia, or chronic obstruction pulmonary disease exacerbated by the arrival of the cold weather in the UK. I think last year's winter was especially bitter. The British Thoracic Society, BTS, so the name of a Korean band, which represents specialist lung doctors and nurses, found that 52% of UK hospitals have already created extra bed capacity to help them prepare for imminent surge in winter demand. And so this was last year, they had to create extra beds and they didn't have the staff to deal with it. If we look here, the BMA said the NHS and a perfect storm of winter pressures. This is about 2019. This report was out in 2019, not in 2020. 2020 is worse, especially if we have a harsh winter this year like we did last year. And so I don't know what's going to happen this year. That's what scares me. I don't know how bad it's going to be. This is from last year again. I think this is a story I covered actually originally. But Georgina is this person here, works as an A&E nurse in London hospital. Every shift, her team of just over 20, starts 4 nurses short because there are posts it cannot fill. And we know that when the government created the Nightingale hospitals, it was all optics because they didn't have enough nurses to fill these positions. To actually work in these hospitals. So it's all optics to say, oh, look at us, we're making these new hospitals on the fly. But they didn't have the staff to do that, to fill those positions. Why? Because they had to take staff from other areas, hospitals that already had shortages. Could you imagine having any job where you got a team of 20, but you're 4 people short already? And her saying it can be worse if people are sick or agency staff don't turn up. And if we don't have testing in place for the winter, then that means that people that, nurses, doctors, and other healthcare officials that have suspected COVID will have to isolate for 2 weeks. For 2 weeks because they might have COVID if they can't get a test or if one of their family members shows symptoms. So what that means is you have a bigger staff shortage than this from 2019. That's how bad it's going to be. And, another reason why we managed to deal with the crisis was because they called in a load of student nurses from universities and things like that. And will the government do that again? Because this second wave may be worse than the first wave. If we actually look at the official numbers here, once the FT page actually loads it, okay, there we go, loads. This wave now is worse than the first wave. It's worse than the first wave. Testing is far higher now, to be fair. But once these numbers keep going, in a few weeks' time, we can actually see hospitalization rates. But look here, we're at the moment we're at let's get rid of that. We're at 191 cases per million. 177 cases per million. 191 cases per million. Okay. Before, 71.5 cases per million, but obviously testing's gone up now. But what if we, eventually we'll look at hospitalization rates and then we'll see how bad it's become. But what we can see from this is this second wave is no joke. It's still spiking. Spain's has flattened out a bit. They've got, a bit of a dip and a bit of a rise. But ours is still going up. Despite local lockdowns in certain areas. So I am worried. About the situation right now. And I worry about the NHS. If the first wave didn't break it, maybe the second wave will. My concern for an institution that is, world famous and I think envied by a lot of people in other countries like the Americans who wish they had a lot of those people wish they had a system like ours where you can go to a hospital and you can get help. No one asks for your medical insurance or for money. That's not how it works. It's worse now because you got to pay for prescriptions now unless you live in Scotland. But that's a Tory thing. That's a recent thing. Pre-2010, I think you didn't have to pay for prescriptions. And we could have lived in a world where we didn't have to pay for dental. And I'm concerned. I'm very concerned. And that's the only thing I can really say about this. I don't know what more to say, but if this winter will be worse than the last one, and the last one was called A Perfect Storm, from the British Medical Association, a very renowned institution. The BMA are no joke. And what we can see, this nurse talking, 4 people short a shift. Okay, so what's he going to do for the mental health of these nurses and doctors and the rest of them when they are shorter on staff because some of them have to self-isolate or some of them are too ill to come into work? What happens then? What's it going to do to these people who are going to be extremely overworked, underpaid? They haven't got a pay rise, but who is getting a pay rise? MPs getting a 3G pay rise per year. Why? because these MPs argue that it's because it's in the hands of an independent body. That's why they're getting the pay rise. Put the nurses paying an independent body, then we'll see what this independent body will say about nurses and how much they get paid, because it's a scandal. That's a secondary scandal, though, with MPs getting a pay rise. I'm going to leave it there. I've rambled on long enough. I'm concerned about the NHS. I think everyone else should be as well. I hope the government gets its act together and manage to source testing for NHS workers at a minimum, because they're struggling with schools and other places already. And I hope we don't have a second PPE crisis as well. But I'm going to leave it there. I've rambled on long enough. Let me know what you guys think in the comments below. Like, comment, share, subscribe, and hopefully I'll see you in the next one.